Greetings, everyone. And on behalf of all of us at Prevention Institute and Equitable Cities, I want to welcome you to today's presentation previewing a forthcoming policy resource focused on equitable transportation and land use policies and practices. We are honored, next slide, Anna. We are honored to be in a cooperative agreement with the Centers for Disease Control and Prevention and to have been working with the team from the Division of Physical Activity, Nutrition, and Obesity. The team there conceptualized this project and has been giving us valuable guidance and input during each step of the project since we entered into it about 10 months ago. I am required to read the following statement aloud. The Centers for Disease Control and Prevention provided support for the development of this webinar and forthcoming policy resource under Cooperative Agreement OT 18-1802, supporting the Active People Healthy Nation Initiative, a national initiative led by the Centers for Disease Control and Prevention to help 27 million Americans become more physically active by 2027. The findings and conclusions discussed in this webinar are those of the authors and do not necessarily represent the official position of the Centers for Disease Control and Prevention. To learn more about Active People Healthy Nation, visit the website listed below. Thank you to the folks at the CDC. With that, I'd like to introduce on the next slide members of Prevention Institute team and the principal from Equitable Cities who you will be hearing from today. Prevention Institute is a national nonprofit organization whose mission is to build prevention and health equity into key policies and actions at the federal, state, local, and organizational levels to ensure that the places where all people live, work, play, and learn foster health, safety, and well-being. Prevention Institute will be 25 years old this October. Today, you will be hearing from Jasneet Baines, Associate Program Manager at Prevention Institute, and Rob Baird, Program Manager at Prevention Institute. In addition, we are honored to partner with Charles T. Brown, founder and CEO at Equitable Cities. Equitable Cities is an urban planning, public policy, and research firm working at the intersections of transportation, health, and equity. Between our two organizations, we've dedicated decades of leadership and professional service to advancing equity in transportation, safety, land use, and promoting safe physical activity. This is a particularly dynamic time for this work. As you all may know, there has been significant federal investment in fiscal year 2022 funding to help communities ensure safe streets and roads for all to address and improve the crisis of roadway safety issues. In addition, as an early act in 2021, President Biden signed an executive order advancing racial equity and support for underserved communities through the federal government. This creates a real climate for advancing racial equity through government action. In addition, President Biden's May Affordable Housing Plan aligns with the Centers for Disease Control's Roots to Destinations work, emphasizing the importance of zoning reform, which is being supported through discretionary funding within the Bipartisan Infrastructure Act. U.S. Department of Transportation roadway safety design strategy is focused on safe systems to significantly reduce serious injuries and deaths on highways, roadways, and streets. As you all know, achieving active community environments to support physical activity and health in communities merits attention to the unique opportunities and challenges that exist. Prevention Institute and Equitable Cities are principally focused for this project on the issues of advancing equity. And in the work of Prevention Institute, it is not possible to achieve health equity without a focus and a centering on racial justice. And so the policies and practices you will see featured here today throughout this webinar really are at that intersection. And we are excited to share those with you. As I move us into the content for today's program, I'd like on the next slide to acknowledge the subject matter experts, an esteemed group of professionals who have helped guide us through this project throughout its implementation, providing initial guidance through subject matter expert interviews, document review, and focus group sessions. In addition, I'd also like to thank the following promotional partners who did an extraordinary job with outreach, helping both Prevention Institute and Equitable Cities to disseminate this webinar and the forthcoming resource through their networks, emails, newsletters, and social media. Thank you all so much. It is not possible to do work of this scope and scale without your partnership and collaboration. With that, I'm happy to turn it over to my colleague, Jasneet Baines.
Thank you, Manal. So today's agenda includes an overview of the project purpose, timeline, and background on the forthcoming policy resource. I will share the process to develop the policy resource, and then I will describe the 6 key ingredients that were illuminated during the subject matter expert engagement process for advancing equitable transportation and land use policies. Rob will then provide a preview / sneak peek of the policy resource and share some selected examples of the types of policies and strategies you can expect to see in the policy resource. After that, Charles will lead us through a poll to engage today's participants and gather reactions and responses to specific aspects of the policy resource. That will be followed by a moderated Q&A. Then we will conclude with closing remarks and information on where to find the forthcoming policy resource. So before we dive into today's content for today's webinar, I'm going to quickly walk us through a few housekeeping details. Next slide. So during the polling section of today's webinar, we invite you to submit your responses to the polling questions via the polling feature. To submit your response to these questions, select your response in the box and click submit. Next slide, Anna. And so throughout today's webinar, we also invite you to submit questions you have via the Q&A box. We ask that you please do not submit questions in the chat. To submit a question, simply click on the Q&A box in the meeting controls located at the very bottom to open the window, type in your question, and click send. If you see a question appear in the Q&A box that you also would like, you can upvote it by clicking on the thumbs up icon. We'll be answering questions during the moderated Q&A portion. We will try our best to answer as many questions as possible in the time allotted. Next slide. This project had 2 purposes. First was to identify a menu of equitable policies to be used in the future to inform implementation within communities and to inform the development of a public health surveillance system. The second was to identify the level and definitions of community that should be considered in the menu of equitable policies and when constructing the technical rubric for national public health surveillance of equitable policies to promote physical activity based upon consensus from experts in the field. For Prevention Institute and Equitable Cities, the concept of equitable policies inherently emphasizes the importance of racial justice as central to achieving health equity. Equitable policies that not only produce equitable outcomes, but also center transparent, equitable, and inclusive structures, procedures, and practices. To help ground us on where we are in the process for the project team and what's next for the work, I'll walk us through the project timeline and provide additional background information. In 2017, the Community Preventive Services Task Force found sufficient evidence to recommend built environment strategies that combine one or more interventions to improve pedestrian or bicycle transportation systems with one or more land use and environmental design interventions to increase physical activity. This project and the forthcoming policy resource builds upon the task force's recommendation to highlight policies that support improvements in transportation, land use, and the built environment while removing barriers that undermine equitable access to safe places for physical activity. Last fall and this past winter, Prevention Institute and Equitable Cities began with interviewing 15 subject matter experts from various physical activity land use and transportation fields. Subject matter expert input was supplemented by a literature scan that aimed to summarize equity implications of active transportation infrastructure, policy and program responses that have been considered in a variety of approaches that exist in different communities. The lit scan included peer-reviewed and professional publications and a review of policy documents. The lit scan was completed simultaneously with subject matter engagement process. This last spring, the project team synthesized the findings we collected from the subject matter expert interviews and discussed them in 2 follow-up listening sessions with all 15 experts in March to build consensus and further inform the development of the policy resource. For the last 4 months, the team translated the findings from both the subject matter expert engagement process and lit scan to draft the policy resource. The process to select the process to select it in determining the policies was to first determine a set of key search terms for policies relevant to active transportation and equitable access to walking, biking, and using transit. These key terms were then grouped into policy themes and formed the basis for the literature scan. An initial lit scan was conducted for each policy theme to explore the breadth of policy approaches taken by practitioners and advocates to demonstrate where policies have been adopted and implemented. Subject matter experts added and refined these key search terms and policy themes and informed the formation of the key elements in the policy resource. In July, 4 experts were invited back to participate in an additional small group discussion to share their feedback on the selected policies and to refine and strengthen the recommendations in areas of emergent consensus. The policy resource presents an initial list of proposed transportation and land use policies that hold promise for promoting equitable and inclusive access to physical activity and safe places to walk, bike, and use transit to reach destinations such as jobs, schools, parks, healthy food, and healthcare for communities facing health inequities and disinvestment. The list of policies and strategies in the resource include ideas from all experts who participated and is reflective of areas of emergent consensus among them. And if you could go back to the previous slide. Based on the perspectives of 15 experts in a body of practice-based literature, the policies featured in the resource were selected because they have promising evidence to suggest a reduction in inequities influenced by transportation and land use policy to increase physical activity. We acknowledge that many folks have been working to understand and identify which policies are promising, but more work is needed to further explore and vet policies. And this includes balancing the requests from communities and practitioners for more direction on what to do and the existing scientific and practice-based evidence that's currently available. Next slide. So this slide presents an initial list of promising policies. So subject matter experts were asked to share, given their specific background and expertise, examples of transportation and land use policies and implementation strategies that they believe would have the greatest potential to reduce inequities and positively impact disinvested communities, particularly communities of color. Prevention Institute and Equitable Cities developed this initial list of promising policies for expert feedback. That included complete streets, Vision Zero, safe routes to school, parks and other safe route programs, inclusionary zoning, calm streets, safe streets, open streets, transit access, safe connections to transit, community land trusts, community benefit agreements, tax abatement policies, limited equity co-op housing, protections against condominium conversion, elimination of single family zoning, minimum lot size requirements, elimination of downzoning and parking requirements, employer assisted housing, affordable housing trust funds, violence interruption strategies like crime prevention through environmental design and decriminalizing jaywalking, participatory budgeting, people's plans, community owned commercial space, resident owned commercial communities, and lastly, land banks. So experts were asked to provide also guidance on how these policies are applicable at various levels of governance. Expert input highlighted equity dimensions and additional considerations for policies, such as policies' interdependence on other policies, how policies work at different jurisdictional levels, implementation and accountability in successful policy adoption, and provided clarity on how policy resource can be used to inform change. Next slide. So through dialogue and consensus building with our experts, 6 key ingredients for advancing equitable transportation and land use policies were illuminated as important elements for equitable policymaking and implementation. Based on subject matter expertise, advancing equitable transportation and land use policies that could result in reduced racialized health disparities in historically disinvested communities and communities of color may come down to baking in equity into policymaking, implementation, and accountability of governments. This policy resource proposes the following 6 ingredients for advancing equitable transportation and land use policies. The first ingredient is that equitable policies are rooted in a health equity and racial justice assessment that paints a clear picture of racialized inequities and clarifies how historical and contemporary conditions impact racialized population groups of interest. The second ingredient is that equitable policies articulate the intent to resolve inequities identified in health equity and racial justice assessments. Our literature scan and conversations with experts suggest that when a policy explicitly articulates the intent of policymakers to resolve inequities through a proposed policy measure, it can help bolster the process of equitable implementation. The third ingredient is that equitable policies neutralize threats to community safety, stability, and continual access to places to walk, bike, and use transit. Subject matter experts discussed how access to physical activity opportunities relates to physical and non-physical barriers, both real and perceived, to walk, bike, and use transit, including the freedom to move about public places, streets, sidewalks without fear of discrimination, harassment, injury, or violence. The fourth ingredient is that equitable policies require inclusive community engagement. Through inclusive participation processes involving historically marginalized or excluded groups, public agencies and decision makers can make policy decisions informed by community residents that may result in more equitable outcomes. The fifth ingredient is that the policies explicitly include equity provisions in their language that address and redress procedural, distributional, and structural factors to improve health outcomes and close gaps. Policies aim to intentionally address systemic barriers in government policies and practices to reverse race-based health inequities. And lastly, the fifth ingredient is that equitable policies mandate transparent monitoring and evaluation to ensure continuous improvement through implementation. Transparent monitoring and evaluation can provide decision makers and community stakeholders with information to better assess whether or not policies meet intended goals and objectives are being met, and therefore create opportunities for a continuous improvement during implementation. Although no formal priority setting process was conducted, the project team selected these 6 ingredients considering 2 factors. One, if multiple or at least 2 subject matter experts emphasize the ingredient in their interview, and 2, if the ingredient was an area of emergent consensus from the listening sessions where 2 or more subject matter experts raised it during both listening sessions. In practice, most experts agreed with the importance of all 6 ingredients and were reaffirmed at the final consensus building small group discussion. Next slide, please. So the policies in the policy resource are selected based upon the consideration of the 6 equity ingredients I just described and an additional 3 factors. These include the policy has been advanced to adoption in multiple locales across the US and has been elevated by multiple relevant issue or place-based organizations with expertise as a desirable policy action. The second, the evidence exists demonstrating the policy's ability to achieve its intended claim and its plausibility to improve health and safety conditions for historically marginalized groups. And third, the government sector decision makers play a primary role in the adoption and implementation of the policy. The selected policies represent key opportunities for advancing equity in transportation and land use, rather than the universe of policies for improving physical activity. So now I'm going to hand it over to Rob, who will walk us through a sneak peek of a sample selection of the policies prioritized in our project.
Yeah, thank you, Jasneet, and good morning or good afternoon to all of you. Thanks for being a part of this webinar with us today. What you see here are 6 policy domains that form the basic structure for how we're putting this resource together. Each of these domains represents a key intersection where the built environment or mobility intersects with health equity and racial justice. And this gave us a basis for how we approach the literature scan and how we're thinking about grouping the promising strategies that are going to be a part of this resource. And just as a reminder, though we consider these promising policies, more work is going on right now to understand how effective they are in influencing physical activity, particularly in communities that are dealing with health disparities and built environment disparities. So the first domain, coincidentally, is titled First Last Mile Transit Connectivity. And this involves the relationship that transit has with physical activity. Research has shown that transit riders are more likely to walk or bike during their commute than the general population. And it happens during that beginning and ending segment of their journey. So a lot of local strategies have looked at how to strengthen these first last mile connections to reinforce ridership, but they don't always have an equity lens to them. And that has the potential to create new access barriers to transit-dependent people who often make up a sizable portion of a transit agency's overall ridership base. So the strategy that we want to lift up here is fair payment accessibility. There's a trend in transit systems going on that's moving more towards a cashless-based system of fair payment. And that relies on technology like smartphones, as well as the data availability to use the apps. And there's been some equity analysis that highlights how a lot of transit riders don't have consistent access to this technology and would have trouble paying fares under this system. And so their recommendations have been to maintain some method of onboard payment still, or reinvesting in things like ticketing outlets or voucher outlets. Some key equity considerations here are that language accessibility is really important when it comes to communicating any transit system changes. And this is why involving community intermediaries or grassroots organizations can be really vital, both in the upfront sort of policy design or system design stage, where because they have the ability to really highlight equity dimensions and bring those considerations to the table, as well as their ability to communicate about those changes, promote those changes, or not promote, but communicate about them to a wide audience, given their reach in communities. The next policy domain is pedestrian and bicycle safety. This has to do with how we design and manage our roadways, streetscapes, and public realms to either be auto-centric or more adapted to various modes of travel. And this also involves how people use idea frames or concept frames to advance the need for safer streets, because we are talking about a shift of norms and expectations about how our streets are used and who's prioritized. It also has to do with power building strategies that communities use to advance these changes and to sustain support for them once they become part of the physical environment. So there's 2 strategies that we're highlighting for this domain. The first one is complete streets. This has to do with the idea that all users in travel modes can have space within the street realm if we prioritize them and plan for them intentionally. So this starts with private vehicles, but it also involves transit service as a distinct form of travel mode with its own needs, as well as pedestrians and cyclists who are also part of the street realm. Complete streets can take the form of detailed local plans that describe tactical streetscape improvements based on locations of concern in communities. But they can also be advanced as policy directives that guide the work of various agencies, all who have some involvement with the street realm, whether that's the transportation department, obviously, but also public works departments, planning agencies, as well as public health agencies even. Some key considerations for this: complete streets should not be applied as a one-size-fits-all approach. because streetscapes are valued and used differently depending on the socioeconomic or cultural norms that exist in the community. And that's why authentic engagement and inclusive and participatory planning methods with the local leadership in a community is really essential for designing and implementing complete streets effectively, and for sustaining that general public support that's needed to continue forward with complete streets once people start interacting with those changes. And interagency collaboration is also a key for success because, as I mentioned, there's a lot of different agencies who have some involvement with the street realm, and there's not always a well-established routine of communicating or working outside of silos or sharing information and intelligence amongst those agencies. So oftentimes it's community organizers and other supporters who are pushing agencies to work with each other on these changes for maybe the first time in a long time. The other strategy here is traffic calming strategies. This seeks more specifically to deter unsafe vehicle speeds and driver behaviors and to mitigate conflict points between vehicles and pedestrians and cyclists within the street realm. And this happens through the placement and composition of physical features within the roadways. These practices can be implemented as standalone planning efforts for certain street segments that are a concern in a community, but they can also be included as key tools or mechanisms within broader citywide or countywide strategies to reduce traffic injuries and collisions. One key consideration we want to highlight here is high injury collision analysis and the role that that plays in really identifying where investments are needed and where funding should go. Because in our experience and in the experience of people that we've interviewed and worked with, funding for infrastructure tends to flow naturally towards communities that have more political voice or power. And that can actually be a real barrier to equity. And so using an analysis that maps hotspots for injuries and fatalities and overlaps that with equity indicators such as race or income can really highlight that there's an injustice that's happening here that's really bearing down more on Black and Brown communities. And the analysis can actually be used as a tool to tie that funding in a more direct and insurable way to the projects that are the most needed. Also want to highlight here that traffic calming can be a key way or a key alternative to traffic strategies that rely on enforcement. There has been a trend in the past for pedestrian safety strategies and bicycle safety strategies to maybe over prioritize or lean on enforcement strategies. And there's been a lot of pushback in communities about this because of the way it provides a racialized pretext to enforcement actions that have more of a severe impact and bias on Black and Brown communities. The next two domains have less to do with street networks and mobility and more to do with the way that architecture and land use have an impact surrounding those street networks. A lot of analysis shows that autocentric building patterns create a bleak and inhospitable environment for pedestrians. And that has a discouraging effect on physical activity. Whereas architecture that helps to define and frame the pedestrian realm and enrich it with activity can promote and encourage physical activity. So one way of implementing this idea is through form-based codes and other design standards. These are zoning rules that regulate building design in a more detailed and granular way than a conventional land use or building code would. Common elements of these include building orientation to street frontages, transparency of building facades, and the way that vehicle circulation is arranged through parking areas and through project sites. These can be integrated within an existing code and often are at the local level, but they can also be adopted as a standalone set of regulations. And they can also be adopted as qualitative guidance for review panels who review project proposals and issue development approvals. Form-based codes are often used to encourage development where it has been lacking, either due to economic disinvestment or redlining and those kind of legacies. And this is also why it may not be met with enthusiasm right away in communities that are worried about intensive economic investment or transformations, cultural or economic transformations in communities. Form-based codes can have tailored standards that accomplish equity objectives, such as smaller building formats or commercial formats that are more similar to what the previous housing and commercial formats were, so that it preserves space as opposed to, say, like luxury formats or boutique formats. So that's something to consider and work with local partners when you're tailoring form-based codes. The next domain, another key factor related to physical activity, is having relevant and attractive destinations to walk to or bike to in your community. And so this is related to the policy domain of health promoting land use. Having relevant destinations to walk to is a particularly important in communities that have encountered and are dealing with legacies of redlining and disinvestment. And so improving access to things like healthy food and culturally relevant business is part of how the public realm can be invigorated in these communities. One strategy that we want to highlight for doing this are community benefit structures. These are basically zoning rules that standardize exchanges of community benefits that are provided by development projects. And these would create spaces for things like childcare services, healthcare outlets, arts programs, locally owned small businesses, green space and publicly accessible plazas, expanded sidewalks. What we know anecdotally is that there have often been challenges to sustaining these spaces because they're often designed as an afterthought. They're not revenue producing spaces. And this is why the role of community intermediaries is really important for this kind of tool, both for the design phase of the project, where local organizations can really give good intelligence and design input on how to make these spaces functional and relevant to community service providers and other community-based organizations. And then they also can play a role in management of those spaces to ensure that the spaces are really going towards providing a community benefit for the community. Also, and I'm going to say this for housing too, there's a lot of detailed considerations that are important, like on-site or off-site location of benefits, the availability of fee-based alternatives rather than the space. So it's important to work through those details. And there is some guidance out there from issue experts about how to do that well. The next two domains haven't been as commonly associated with pedestrian activity in the past, but it was important for us to highlight intersections where the built environment and physical activity strategies interact with other key issue priorities in communities. And these two, displacement and community safety, are often priority issues in communities of color and other marginalized community. So part of what we wanted to show is how pedestrian and bike strategies may not succeed as much or have limited success if progress isn't made on some of these issues, and if knowledge sharing and collaboration isn't happening across some of these issues. So when it comes to displacement, there's growing awareness that the intended benefits of improving access to things like green space, the built environment, opportunities for physical activity may not be realized by existing residents that are intended to benefit if those people and households can't afford to remain in the community. And there's emerging evidence that displaced households often move to communities that have more severe built environment disparities and less physical infrastructure that promotes health and physical activity. And this is on top of other impacts, such as the loss of social networks and increased commute burdening and commute costs that these households face. So there is a lot of policy out there that addresses displacement. And this is one area where the academic literature has some pretty good consistency as far as what are the platforms of different policies to consider and how they work together to address displacement, because it does take a holistic approach. One that we want to highlight here is encouraging inclusive housing development. And these are really a set of different policies that can be considered in a community based on the context. So inclusionary zoning requires or incentivizes new development to include affordable units that meet the needs of existing residents. There's also ways to generate housing funds either through tax increment financing or linkage fees that tax market rate development in communities where that's having an impact on the overall real estate market. There's also a lot of zoning and permit incentives, from density bonuses to permit streamlining processes. There's also an emerging trend towards public land disposition. This is a lot of people are finding out that a lot of local governments have sizable sizable land portfolios for maintenance yards and things like that, or just unused, that could be used a little bit more effectively in communities where housing is a need. And so there has been cases where lands have been deeded to mission-driven housing developers who will often include supportive services and community supportive services in those housing developments. One thing I want to say about these is that developing affordable housing is important in it's not just an urban strategy or an inner city strategy. It's really a region-wide strategy, and it's important in different places for different reasons. So in suburban settings, which have historically been allowed to exclude people based on housing, it's important to develop opportunities through housing development in those communities that are affordable, so that people have access and mobility to the employment opportunities that they're seeking and the education opportunities that they're seeking. It's also an important strategy in an interurban context, especially places where intensive reinvestment is changing the economic and cultural fabric of the community. Having affordable housing developed can be a fallback option or a safety net of housing that people, longtime existing residents and young people who are moving into independent living, can have a place to stay in the community to fall back on. And then, another equity consideration is that, simply put, the devil's in the details when it comes to any kind of housing policy. The equity impacts, either good or bad, will often hinge on key details like the rules about demolition and unit replacement, the availability of in lieu fees, the different affordability levels that are being encouraged, and the composition of the units and what kind of households those are being made available for. And then the last policy domain is community safety. And this was included because, despite the best efforts to improve streetscapes and invest in bike and pedestrian infrastructure, there's a growing awareness that there are still discouraging factors for walking and biking that exist in communities where people have feelings of insecurity and potential violence within the public realm. These are particularly important considerations in places where trauma from violence may be part of the local memory and consciousness. And in my own experience as a pedestrian planner and a lot of other issue experts that I've worked with on these issues, there's a consistent thing you hear in outreach workshops, which is basically like, hey, this investment's great, it's about time we've gotten it, but I may not use it, and a lot of other people, particularly youth and mothers, may not use this infrastructure if there's still insecurity within the public realm. And so this really emphasizes why there needs to be collaboration and knowledge sharing across different efforts to work on violence prevention. And there's really a lot of innovation happening in this field right now, and a lot of room for experimentation and piloting. One strategy that we want to lift up here is this idea of community safety by environmental design. There's been a number of guides that have come out recently that have sort of unpacked what goes into this practice of community safety by environmental design. These are public space design principles that really emphasize human-centered design, as well as community stewardship, rather than a reliance on enforcement actions and agency surveillance or agency enforcement to make places safe, but more of an organic community safety that happens by the people who use that space, as well as things like vendor and arts activation, on-site health and support services, and emerging innovative ideas like bystander training. And just to reemphasize, working with violence prevention practitioners and other community organizations is really key to both design these spaces well, as well as manage them well, and to really flesh out what goes into this idea of community safety by environmental design. So that's a very quick run through, and I hope that sparks some ideas and thoughts. And now I'm going to hand it to Charles, who will take us through the polling questions.
Thank you so much, Rob. Special thanks to the entire team at Prevention Institute. Also, thank you to CDC, and a special thank you also to Anna and Carmen for helping to make sure that today is a success. I want to invite everyone now to our polling questions. Once you've all answered, I will then moderate a Q&A with each of the panelists here. So in just a second, we're going to relaunch a poll. The poll has now been launched. You should see 10 questions. There are 10 questions from 1 to 10. I'm going to give you about a few minutes here, probably 3 minutes to answer each of these questions. Be sure to scroll down. This is one poll, so be sure to scroll down to the end. So please take a minute there to answer those questions. Thank you. Let's get confirmation that people are indeed seeing those. Right now, we haven't received any responses. Okay, someone said the submit button does not work. That was from Matthew. Can someone else also submit? Okay, Rob is doing them. Someone said questions went away. So what we're going to do is we're going to relaunch these. Okay, so everyone, please, I see all the comments. I'm going to relaunch them. We have not taken them away. Be sure to scroll down when answering the questions. So 1 second here. We're going to do a relaunch for those of you that have already answered. Apologies, but we're about to relaunch. Okay, and the countdown, it is not going away. So just stick with us. 5, 4, 3, 2, 1. There's a relaunch. Make sure you hold control of the box so that you can answer the questions. We don't have a timer set, so they shouldn't go away. If you notice the poll go away, perhaps you would have to zoom out on your screen to relocate it. Okay, now they're coming in. Thank you for those that are answering. Everything is working perfectly now. Thank you. We're up to 75% of participants have responded. Way to go. Let's continue. We're up to 80%, a few more here, and we'll show the results. All right, one or two more. Here we go. We are about to close the poll. Countdown at 5, 4, 3, 2, 1, 0. Thank you. We got nearly 90% response rate on that. Excellent. So what we're going to do now is share the results. You should see them pop up on your screen. The first question we asked is, which sector do you represent? You could see that the majority of the people here today are representing state and federal government, followed by city government and regional and rural agencies. Next, we ask, which fields do you work in? Select all that apply. It appears that the number one field is transportation, followed by public health, followed by urban and regional planning, and then some others. Which regions of the US do you represent? We are mostly represented here, firstly by the Southeast. Welcome Southeast, that's home for me, followed by the Midwest, followed by the Northeast. Thank you, that's home as well. To what degree would you find the policy resource useful to your work? 37, roughly 69% of the people find it useful to very useful in terms of being useful to their work. 0% found it not useful. Which policies resonate with you most? Select all that apply. What we heard overwhelmingly is that the Complete Streets policies resonate most, followed by traffic calming strategies, incentives for community benefits, and inclusive housing development policies. Oh, my bad, I see here as well, community safety by design. Community safety by design was number 2, Complete Streets was number 1, and number 3 was traffic calming strategies. Number 6, which policies would you like to learn more about? Select all that apply. There we can see that the number 1 policy that people would like to learn more about was incentives for community benefits, followed very closely by community safety by design, then inclusive housing development policies, and lastly, once again, complete streets policies. Question 7, and yes, please remember to continue to put your questions in the chat. Question 7 was, how would you use the policy resource in your work? The number 1 way that was stated was outreach and engagement. That's good to hear, followed by developing a policy as well as advocating for a policy. If you stated other on question number 7, feel free to type in the chat what you meant by other there so we can capture that. Question number 8, who do you think should be the primary audience for this policy resource? Select all that apply. The answer was overwhelmingly city government, which was first, followed by state and federal government, and then lastly, regional and rural agencies. Those were the top 3 audiences for this resource, which as stated. And then number 9, who do you think is most likely to guide equitable implementation of the policies, of the policy resource? Once again, number 1 was city government. Number 2 was state and federal government, and number 3 was a tie between regional rural agencies and the nonprofit community-based organizations. The last question, question number 10, how optimistic are you that the policy resource could inspire policy actions that promote equitable and inclusive access to physical activity and safe places to walk, bike, and use transit to reach destinations such as jobs, schools, and healthcare? People were moderately optimistic, about 47%, 24% very optimistic, and 9% extremely optimistic. 0% were not at all optimistic. So we could see here that people are pretty optimistic regarding these policies and their likelihood of inspiring policy actions that promote equitable and inclusive access. So thank you for answering the webinar poll there. I'm going to stop sharing now and we'll turn to Q&A. All right, and I don't think we have another slide, but let's just stay here on Q&A. Everyone feel free to type your questions and use the upvote if needed. Kathy states, communities may have trouble evaluating the impacts of policy implementation. Do you have any specific suggestions for a way to evaluate changes resulting from these policies? Manal, Rob, and Jasneet, I want to invite you back on to answer or respond to that first question by Kathy. If you're trying to answer Manal, Rob, or Jasneet, you're currently on mute. All right.
Thanks, Charles. Kathy, thanks for the question. I was reading it and thinking first about the importance of looking comprehensively at a set of changes together. One of the things, you know, and I think that means setting up either with a set of evaluation partners, a process to look at multiple impacts of change, comprehensive change over time. That is not a very satisfying answer because a lot of times people want to know what is the incremental impact of a singular policy. And so, you know, I think there is work that can be done at that level. But in most of the work that I've done, whether, you know, in tobacco control, in other fields, diabetes and obesity, it's usually the composite of a broad scale strategy that ends up making the biggest difference for communities. And so we tend to look at that as a strategy. Also, I think one of the other challenges with evaluating policy is the long time frame that it takes to move from policy adoption to implementation to changes in either the physical environment or behaviors that make a demonstrable difference in people's health and mortality. And so the other thing that we've done when we're working on built environment policy initiatives is really trying to create an evaluation framework and work with evaluators that help us look at more near-term indicators. So both in terms of decision makers, understanding of the options, looking at norms in the community that might lean towards or suggest the importance or elevation of safety as a public policy concern, as well as other kinds of impacts, greater synergy among coalitions advocating for a set of changes. But I want to turn it back to my colleagues, including you, Charles, if you want to add to anything to that response that I just shared.
Rob or Jasneet, do you have anything else to share, to add to that? No? What about you, Rob?
Well, I think this is one area of research that we'd like to do after, you know, as a second phase of this project, where we can look a little bit more at like we've been aware of this of the need to monitor and evaluate for a long time, but haven't had a chance to really do like a really extensive look into what the academic literature may be saying about it, or what what intelligence might be coming out from community organizations about this. And so, I think that's a key complement to the work that we've done here with the policy resource guide is to now unpack what some of those methodologies for that post-adoption phase.
Thank you. The only thing I would add is that there are a number of scholars out there who have been evaluating the impact of some of these policies. We can follow up if need be with a list of them. Jamie, very interested in hearing more about the background literature and your recommendations on monitoring and evaluation of plan and project implementation as we develop a health equity analysis tool for land use planning processes and plans. So anyone, Rob or Manal, you want to touch on hearing more about the background literature?
I think I'll start by leaving that to Rob or you, Jasneet, and I'll pepper in if I have anything.
Yeah, I can say a little bit about the background literature. We kind of had a two-pronged approach, which was to look across the academic literature for places that really highlighted where the equity dimensions were rising up out of policy research. And then we were also going into the gray literature to look a lot at what issue experts and community organizations were saying. Yeah, this might sound a repeat of what I just said, but I think the monitoring and evaluation, the intelligence with that around that could be robust potentially, and that it would be a good next step to build that out.
I think the only thing I'll add, and it partly goes back to Kathy's question too, is our experience has also, and our conversation with subject matter experts really emphasized that from a practice perspective, communities don't just have a challenge monitoring the impact of a policy, but actually monitoring its implementation. And so often, again, the long time frame between getting a good policy on the books and making sure the implementing agency stays on point in terms of implementing it according to the wishes of the governing board, as well as the policy that advocates that advocated for it is a problem. So even, what we did in terms of looking at some of the literature and practice guides or policies on the books, we still don't know with fidelity in all cases how well the jurisdiction was doing and actually implementing the policy. And I think from an equity standpoint, both in terms of procedures as well as allocation of resources, the implementation of the policy, much less the evaluation of it according to plan, is still a challenge. And Charles, and also want to invite you to add into and layer in if you have anything based on your experience.
Yeah, I think you all have answered it sufficiently, so I'll move on. Michelle asked, what other federal organizations or policies have you tied into, such as EPA or DOT? In my area, which is Fairfax County, VA, I understand there's funding for Safe Routes to Schools infrastructure, but not really integration with transportation plans or safety data or equity. Any thoughts?
Well, I'd like to know more about some of those cases that Michelle is raising. I think what we looked at a lot, what we came to a lot was, because one of our goals of this project, sorry about the background noise here, one of the aims of our project was to identify how these policies are advanced at different levels of government, because sometimes there can be similarities, but sometimes there's very real differences, and there's interrelationships. What the state does or what the Fed does or may affect what a local agency does, and then also like what a regional agency, particularly a transit agency, does can also affect things, and there's need for complementary action. But so what we looked at a lot for the federal level was where standards were integrated with funding criteria. And there's certainly a lot of, whether we're talking about food or pedestrian safety or other types of infrastructure. Like there's a lot of potential to better integrate those funding streams with criteria that's really equity based, as well as also very collaborative and participatory and rooted in community decision making. Can anybody hear me? And then as far as agencies, yeah, DOT was one of them. FDA, as far as like health promoting resources, has a role to play. And then also like all the various housing funders have a role to play in that as well. So, and yeah, so I would say those are the three that come to mind for me most.
I'll just add in our, what they call our, I forget what the word exactly, primary audience for this particular cooperative agreement was municipal, sort of local city county governments. So I think we focused also our literature review and scan of the gray literature at that level, the municipal level. That being said, your point, Michelle, about sort of where funds originate and collaboration, I wish that our Centers for Disease Control partners were they could share with us the work that they've done to collaborate across other entities, because I believe there's a lot that they have in play at that. So we will bring this also back to them as a question. They're on listening today, of course, but for further consideration. So thank you for that. We know this. The actions at the federal do filter down significantly and impact the kind of integration you're talking about, Michelle.
The next one we have is, did you consider policies that increase safe routes or safe routes to parks, similar to safe routes to schools? I work in parks and recreation and have noticed that there isn't much interest on safe routes to parks, and we have similar visitors such as children and other groups such as seniors, residents with disabilities, et cetera. And I know PI is excited to answer this one. So,
yeah, I was actually going to answer in text, but I pressed the wrong button. But yeah, in a nutshell, yes, we looked at safe routes to schools, safe routes to parks, and safe routes to transit. And yeah, I think I'd agree with you. The only stuff that we found that was specific to safe routes to parks seemed to be coming out of the Seattle, Kings County area. But otherwise, the methodologies and framings that we came across seem to be very similar to the safe routes to school, which I guess was like the original spark point of that idea. I guess safe routes to school has this really important built-in component of like parent organizing and school-based promotion, both on a policy level as well as on a health promotion level. I guess with the parks component, you can't really do as much parent organizing unless you have like a youth sports program or a youth arts program or something there. But it seemed the examples I came across seemed to be more rooted in like park advocates in those areas that we're talking about that. So if maybe the background analysis of safe routes to parks will grow in coming years, but it seems to be pretty new at the moment.
I'll just add on. Thank you, Dulce, so much for the question. As an organization, and we are deeply interested in parks and park equity and the safe routes to that as a key destination. And the Centers for Disease Control is also. I think there is more work to do there, as Rob said. LA County's Metro has also done kind of a piece, an analysis on some safe routes and using microtransit around parks. I think this is an area where the jurisdictional issues that divide parks and the local streets often becomes a challenge. And so this is in a way, the metaphor or the parallel to what Rob was sharing with the last two intersectional issues, where we need to do that cross-sector sharing and also knowledge sharing and strategy to make sure for the experience of community, parks are not like islands separate from the streets that they use to get from their homes, apartments, and navigate to get to those beautiful destinations in communities. So I do think more is needed there and would love to be able to take that on. I also think the Centers for Disease Control has significant emerging work in this area. And I think your question positions us to do more. Thank you for asking that. And also I'll say our organization just launched a major national initiative with funding from Doris Duke and Robert Wood Johnson to fund 14 power building groups across the country to advance park equity. And I hope that through that practice, some momentum is built that gets at these issues, because these groups that we funded are deeply connected, not just to parks, but the whole fabric of community. So I hope we learn a lot with park agency folks and community residents about how to advance this in people's lived experiences.
Thank you. I'm also typing in the chat. I've done work around safe routes to parks and open spaces as well. So I just provided you with a resource there. Rob, Jasneet, and Manal, I want to go back to the poll. I thought there was some interesting results there. Number one is which policies resonated with them the most. Were you surprised to hear that complete streets was number one, or were you more surprised to hear that form-based codes and fair payment accessibility was last? So I just shared, I could reshare, but complete streets came in at number one in terms of the one that resonated most with people, followed by traffic calming strategies and community safety by environmental design. Those were the top three policies that resonated most with people. Any thoughts on that?
I'm curious about the fair payment accessibility. I think those who work in transit agencies have a much different dashboard of concerns than someone working in another public government sector agency. And so I just wonder if there were many transit agency folks who are part of our discussion today or not, that could skew that a little bit. Complete streets and
the majority were from transportation. Doesn't mean they're from transit, but the majority were transportation.
Okay, yeah, that is interesting. Complete streets and traffic calming at the top, no, that's not, or near the top, that's not at all surprising to me. I'm a little surprised to see community safety by design as high as it is, and I think that's exciting. I think that's also one that's maybe a little bit more on the theoretical side and less on the mechanical side. And so hopefully that curiosity can be met with some good input by our resource and other ones that exist out there.
Yeah, when we asked which ones they would like to learn more about, the number one response was incentives for community benefits. Any thoughts on that? I also want to go back to complete streets resonated. I think complete streets, number one, the Smart Growth America, the Complete Streets Coalition has done an outstanding job. I think marketing, advertising, and delivering technical assistance around complete streets policy adoption and implementation. So it has a time component, a training component, a familiarity with people, unlike a lot of these policies. So I think we can look to what has been done by way of complete streets as a model to advance other policies such as the ones listed here elsewhere throughout the country, because I think they've done a dynamic job there. But when it comes to incentives for community benefits, that was the one that people would like to learn more about. Any thoughts?
I think that's exciting because I think that's an idea that has a lot of growth potential. And one plug I want to give is I spent so much time trying to find this consultant report to the city of Boulder that was embedded in this 300-page council packet. And it was a really excellent report because it gave 24 different local examples of community benefit structures and went into a lot of detail about both the content of those benefits as well as the structures to actually create them. So I don't have a link at hand, but I could try to find one in the next few minutes and try to put it in because it was hard to find. Someone needs to call Boulder, or if Boulder's on here, can you just fish that out and make it available? Because it was a really excellent resource.
Lastly, I'll touch on another poll response was how
Charles,
would
can
you,
I say,
go
and I
ahead.
don't know if I have total understanding of everything that's included in the basket of incentives for community benefits, but I would just say there was a time in the work when the conversation around community benefits, particularly as it related to low-income communities and people of color, was the price of private developers doing business. And so they would always bake in a package for a community benefits agreement. And sometimes the benefits were more ephemeral than the long-lasting impact of the project. And so I think there's probably more things that are positive and durable for communities, but in some cases, we've seen sort of an early conversation around sort of minimum wage, short-term seasonal jobs as being part of the community benefits package, but communities end up, I want to say giving away critical things. And so I think there's also a question about the strengths of the advocacy community to be able to be very clear on their non-negotiables in terms of long-term affordable housing, where we are, meaning Rob, Jasneet, and I, based in Los Angeles. You all know we were in the middle of a, affordable housing and homelessness crisis. And so, short-term fixes that ask housing developers to do affordable housing for a few units for a couple decades is just not sufficient for the tidal wave of need that we have. So I think that goes back to Rob's point about the devil's being in the details, not just when the deal is being negotiated, but when we talk about these land use transportation impacts, knowing that we're talking in terms of 40, 50, and 100-year and generational cycles.
That's a great point, and it makes me want to riff off that a little bit. In that, I think community benefits policies are on the risky side. There's some inherent risks with them because there's a negotiation there that's just really real, and you're trying to promote the idea of community value capture from development, but you have to stay true to that all the way through, and there's places where that may break down and the community may not get the deal for what it's giving up. And it doesn't replace structural need either. I think that the more challenging land use policy realm that I'd personally like to see be really active over the next 10, 20 years is working on things like inclusionary zoning and making that really good, and anti-displacement measures that really value community tenure and community ownership. That's challenging for decision makers to take on, but I think the need that we're living through right now is demanding it. And so let's be bold,
Yeah, and I think that's a great segue. But before I hand things over to Manal to kind of showcase, when we asked how would you use the policy resource in your work, the number one response was outreach and engagement. So the more and more we can develop tools, resources, et cetera, for people to support their outreach and engagement efforts, the better. So turning things over now to you, Manal, to close this out.
Yeah, thank you so much. And Charles, for that, your excellent skill moderating Q&A and polling questions is much appreciated, as well as your insight throughout the effort. So thank you. I noticed 2 more questions came into the Q&A. We will take those offline, and hopefully in the follow-up, we can either respond to them or incorporate them in our further wrap-up conversations. So again, thank you, Anna, for going to that side. Again, thank you, Charles, and the team at Equitable Cities for your partnership in this work. I want to appreciate the richness of the dialogue in the Q&A. I know that's just scratching the surface on the conversation we all could have if we were together in a conference, doing all we can to advance equitable transportation and land use policies in practice, as well as the underlying evidence base to support that work. I know that we can continue to make progress and see this work evolve as we have seen, and hopefully continue to accelerate progress for Black and Brown and low-income communities, because many of the policy innovations that we have and have evidence before have simply not resulted in the same level of benefits or the reduced levels of burdens for those communities. And that is really who we are seeking to improve lives for as well. So in reaching the for all goal. I want to also acknowledge and thank CDC, the Centers for Disease Control and Prevention, for your leadership in promoting this agenda. And finally, I will turn it over to Jasneet to just do a couple seconds of final wrap up for the project and let you know how we will follow up with you. Thank you all so much for being here today.
Thank you, Manal, and thank you, everyone. We encourage you to please check out the project webpage on Prevention Institute's website for the forthcoming policy resource, the webinar recording slides, and any project updates. We'll drop the, Anna's just dropped the link in the chat. And so we look forward to sharing the policy resource with today's participants, and we'll email you follow up when it's available and on our website, including the recording. And so with that, we'll end today's webinar, and we wanted to really thank you for joining us, and we hope you have a great rest of your afternoon. Thank you all.
Bye-bye.